Health Officer, Dr. Jeff Duchen.
Thanks, Sharon, and welcome everyone. Thanks for joining us today. I'll provide an overview of where we're at with our outbreak, speak a little bit about the vaccine rollout, and then welcome your questions. Our COVID roller coaster ride continues with ups and downs, but we continue to see high levels of COVID-19 transmission and high levels of risk in our community. After about 2.5 months of a steady rise in cases that began in September, our COVID-19 case reports peaked in early December at around 770 cases a day. They then decreased throughout most of December, but now are again rising. Beginning around December 27th, we are on another upswing. So from December 27th through January 2nd, the incidence of COVID-19 in King County has increased by over 30%. This increased number of COVID-19 cases reflects the activities people engaged in during the Christmas and New Year's holidays, including travel, family and social gatherings, and the ongoing spread of COVID-19 in workplaces and other locations across the region. Over the last 7 days, we've reported about 570 cases daily. The incidence remains highest in the cities in South King County, particularly Auburn, Kent, and Federal Way. And this increased number of COVID-19 cases reflects the activities people are engaged in currently. Over the last full week, over 150 COVID-19 cases were admitted to the hospital, and daily counts have been relatively stable over the last 2 weeks. Through the month of December, we averaged about 50 deaths per week, and the median age remains around 81 years. At this time, we can't predict how high the current increasing trend will go or when it will level off. And this is especially worrisome to me, given the threat of a more contagious variant strain of COVID-19 that's already been found in many US states and will inevitably be found here at any time now. Adding strains that spread more readily to our outbreak will be like throwing gasoline on a COVID-19 wildfire. Unless we take strong actions to stop it, more transmissible strains will lead to rapid, potentially explosive increases in cases, hospitalizations, and deaths. And this will compound the impact and suffering from COVID-19 across our community and potentially overwhelm our hospitals. And I want to be very clear on this. We should expect the variant strain to become widespread here, and that will make the outbreak harder for us to control. To avoid this, to minimize our risk, we need to beware and prepare. Vaccines are an important part of our defense once enough of us are vaccinated, but they cannot be our only defense. And I know no one wants to hear this. It's the last thing I wanted to hear. But the virus has gotten smarter and faster. And we will need to work harder and better at COVID-19 prevention, taking all possible precautions now to stop the spread in our personal and social lives, in our workplaces, and wherever people gather. The bottom line, though, remains that vaccines are a light at the end of the tunnel, but we're still in the tunnel, and it's gotten a bit longer. Now I'd like to share with you a little bit of information about the vaccine rollout. As you know, we are in Phase 1A, which is vaccination of frontline healthcare providers at risk for COVID-19 in the context of their work with patients, long-term care facility residents, and long-term care facility staff because of the highest risk of death in that population. In King County, Phase 1A includes an estimated 140,000 healthcare personnel, thousands of EMS personnel, and 40,000 or so long-term facility staff and residents. We have the highest number of eligible people for Phase 1A in the state of Washington. To date, we've been allocated in King County a little over 141,000 doses, which is about 23% of Washington State's allocation, about 4,000 doses a day since the initial shipments started in late December. Of these, we know that at least 83,172 King County residents, or 60% of the total doses we have received, have been administered. So there are additional doses that remain in inventory for future appointments. There are additional doses that have been administered to non-King County residents that we cannot count at this point in our totals. And we know that some doses have been administered and not yet entered into the immunization system that helps us track doses administered. So we know that likely over 60% of those doses have been administered today, and more are being administered each day as appointments are filled. About 65% of physicians, surgeons, and registered nurses in King County have had at least one documented dose. About 70% of our licensed physician's assistants have received at least one dose, and about 60% of EMTs and paramedics, and about half of dentists. Unfortunately, we have yet to reach many of the medical assistants and medical technicians who are eligible for vaccination. About 30%, as far as we can tell, of licensed assistants and technicians in King County have been vaccinated to date. That said, our main challenge is clearly not having enough vaccine for all who are eligible. And as we know, the resources for vaccine distribution are limited. Our healthcare facilities and our community health partners are working very hard, both to manage COVID-19 cases, as they have been for the past 10 months, but also now to stand up vaccination clinics. And we're working to increase our vaccination capacity when we have adequate vaccine supplies to take advantage of. Before I take questions, I just want to also say that we're encouraged by the news from President-elect Biden about additional resources that will be forthcoming to support both COVID-19 vaccination campaigns as well as the overall response to this terrible epidemic. And we look forward to learning more details about that. So with this, I would like to turn to you and happy to entertain your questions.
Thank you very much, Dr. Duchen. Let's go ahead and start with Allison Grande. You're unmuted.
Thank you, Dr. Duchen. Couldn't we get your reaction to the information coming out today from the feds when they talked about releasing the rest of the stockpile, these second doses? Now it's appearing that maybe there isn't a stockpile.
Well, it's incredibly frustrating. I mean, we need doses here to vaccinate eligible and at-risk people. And, you know, whether this is true or not, I can't vouch for, but it would be very disappointing if indeed we're not going to get the additional doses that we had been expecting. And as I think, as you all know, the pace of vaccine delivery to the states has not kept up with what was advertised and what was promised by Operation Warp Speed. So, you know, at baseline, we're not getting as many doses as we anticipated. The doses haven't been increasing each week as we were told they would. And, you know, we have very little insight into the supply issues at the federal level, but we are ready and willing and very eager to receive whatever doses are available as soon as they can come to us and get them to those people who are at highest risk, and then ultimately to everyone who needs one and wants one.
Thank you. And for news media, just continue to use the raise your hand function. And if you can share your media outlet, that will also be helpful. Hannah Kim, go ahead, you can ask your question.
Hi, Dr. Duchen, Hannah Kim, Q13 News. Thanks for taking my question. I had a two-pronged question, and the first one is a follow-up to Allison's question. So I know there is frustration, obviously, from state and local leaders about the federal government not giving the promised doses. But as of yesterday, 36% were administered of the vaccinations in the state. So there's clearly a state distribution issue. What needs to be done to, you know, mitigate that, you think, moving forward? So that way, even if we get these federal doses, it sounds like we have a lot that we're sitting on. The second question is, for those people concerned about the second dose, should there be any concerns in that? Will they be able to get the second dose with all of this, questions about whether or not we're going to get enough vaccines?
Mm-hmm. Thank you for your questions, Allison. I can't really speak to, what's going on outside of the county with respect to doses administered compared with doses allocated. Here in King County, as I've mentioned, we've administered over 60% of the doses that we've been allocated. And I believe that, because we can't count every dose that's been administered, the number is even higher than that. And of course, some of the doses administered by our King County providers are going to non-King County residents. We don't count those either. I think we're doing a good job. We can certainly improve, but the main bottleneck, the main barrier here is vaccine supply, at least in our county. There clearly are lots of reasons why vaccines may not be allocated in general. It's a very complicated process. There need to be partners in the community who have staff, scheduling systems, can provide access to their constituents, which may vary very widely from county to county. Here in King County, we're very fortunate because we have a tremendous healthcare system that's very collaborative with our public health system. We've seen thousands and thousands of doses, administered by our hospitals, our community health clinics, and we are in the process of planning a significant expansion of access points in the community, both in South County and elsewhere, to address the needs that we anticipate as more vaccine becomes available and more people become eligible. However, at this point, we have more people who are eligible than we have vaccine for, and we're moving the limited supplies of vaccine that we get out as quickly as possible. I would refer you to my colleagues at the State Health Department to speak more about some of the challenges that other counties may be experiencing.
Thank you. And Kayla Lafferty, you're unmuted.
Hi, actually kind of a follow-up on a little bit of what you were just talking about. There seems to be a little bit of a disparity between different counties. We're seeing Skagit County saying they haven't received new doses in 2 weeks, while Clallam County is having enough to open up vaccinations to phase B1. Where does King County fall kind of in this array? And can you just give us a rundown of how it's being communicated with each county, how the state is working with this, and just kind of vaccine allocation in general?
Yeah, thank you. I'll answer your question, and then I need to go back to Allison's second question about the second dose. Yes, vaccine allocation is managed by Washington State Department of Health. And as I've mentioned, we've received about 23% of the state's total allocation. Now, I think everyone realizes we have significantly more than 23% of the state's frontline healthcare providers in King County and in our metro area. So proportionally, we haven't received the amount of vaccine that we would expect to be able to offer it to all the eligible healthcare providers. The way the vaccine allocation decisions have been made, I think, should be really a question answered by our colleagues at the state who are making those decisions. Getting back to Allison's second question, the second dose is critically important. We definitely want everyone to understand the importance of receiving the second dose of vaccine, regardless of whether you receive the Moderna or the Pfizer vaccine, as scheduled. And I believe our federal partners are not intending to have second doses delayed. So we do need to account for the need to administer second doses as we vaccinate. And what we are hearing from our federal partners is that they are confident that the production capacity of the two manufacturers is adequate to meet the ongoing demand for second doses. Now, clearly, we're going to have to wait and see a little bit about how the allocations roll out. If we have a very limited amount and we're not getting increasing doses, it's not going to be possible to give everyone a second dose that gets a first dose. And we're going to have to develop a local strategy to make sure here in Washington State, we ensure that those people who get the first dose will have a second dose available. But I think, with the transition happening now, with the Biden team coming in, There's a little bit of, I think, a gap in the communication, and we need to rapidly establish with the new administration what the situation is with respect to doses, and ensure that we will have the ability to give everyone who gets a first dose a second dose within a reasonable time frame. You know, it's not a problem to be a little bit late, a few days, a few weeks even, but giving doses early is really the thing that we try and avoid in all immunization practice. But we do want to get these second doses in as close as possible to their recommended time interval.
Thank you. And I'm going to share with you, Jeff, a question from the community. How many people need to be vaccinated in King County for kids to go back to school in September? And can you assess at all what you think the chance of that happening in time would be?
Yeah, thanks. You know, the thing that's most important in the context of getting kids back to school is the level of community COVID-19 transmission that we're seeing. The higher level of transmission that we see in the community, the higher risk there is for acquiring COVID-19 anywhere in the community, at work, anywhere you come into contact with others in the community. And the risk also would be higher in schools when there are higher rates of transmission in the community in general. And I want to get back also to, as part of this question, to talk about the variant strain, because again, these strains are more contagious. So what that means is anywhere you would come into contact with someone with COVID-19, your risk of becoming infected would be higher. And your risk of spreading COVID-19 to other people would be higher. So for that reason, it's incredibly important for us now to really try as hard as possible to follow the basic COVID-19 prevention measures that will interrupt the spread of the new variants, as well as it interrupted the spread of the previous viruses. It's a question of how comprehensively and how thoroughly we practice things like wearing face masks and the quality of those masks. You know, they should be good quality, double layer, snug fitting. You can wear one mask on top of the other. As a matter of fact, it is a good suggestion as long as you can still breathe through it, and make the top layer snug down the bottom layer mask. But mask wearing anytime we're around others outside of the household, avoiding contacts, avoiding unnecessary contacts, limiting activities, avoiding crowded indoor air spaces. We know that this virus transmits particularly well indoors where there's poor ventilation, and especially where people are not wearing masks. Increasing ventilation in the home, in the workplace, and anywhere people are for prolonged periods of time will help decrease the risk. And of course, continuing to practice physical distancing from one another to the greatest extent possible, doing as much as possible outdoors, and good hand washing and environmental cleaning are still important. But it's really just a matter of degree. We're going to have to work harder to achieve the same level of suppression. And currently, we have too much COVID-19 happening. So we're really going to need to step up our game in the second half, because the virus has gotten a lot smarter and a lot quicker.
Question from Tammy Mutasa.
Actually, can I?
Yes,
sorry,
please,
Chair.
go ahead. No,
so to get back to the original question about vaccination, there is no requirement for any particular level of vaccination to make any type of activity safe or unsafe. What makes an activity safe or unsafe is the level of COVID-19 transmission in the community. And so we reduce the risk by taking preventive measures. We reduce the risk when more of us are vaccinated, but we know over time, the number of vaccinated will increase, but we don't have a lot of control over how fast that's going to happen at the moment. It's really going to depend primarily on how rapidly the vaccine supply can be made available to the American public, and how quickly and how thoroughly people become vaccinated. And it's also important to remember that there is not a vaccine license for children right now. So at this point, we would expect children to be going back to school unvaccinated, and it won't be most likely many months until we have vaccines for children, if they become available at all in the near future.
Thank you. Tammy Mutasa, you can go ahead.
Hi there, Dr. Duchen. Thank you so much for your time today, as always. I know a lot of people are talking about this vaccine, but I'm just wondering how on earth we are going to reach our 4 metrics to get to phase 2 in each region. Is King County's region, I guess Puget Sound, are we even close? It seems pretty unattainable, especially with the vaccine so far away and our cases pretty high. And I think right now we only have maybe one of the metrics reached, which was the ICU beds that were under 90%. But how are we going to get there? I mean,
oh, I think it's a great question. We're going to get there by doing the things that we know work to suppress COVID-19, by wearing face masks compulsively and whenever we're around others, by keeping our distance, by taking all precautions in workplaces and anywhere we socialize and get together with others. We can suppress this virus. Other countries have done it. So what we've definitely had trends where our 14-day case count was decreasing. We need to continue those trends. We can do it again. We can get our hospital admissions down again by decreasing our level of interactions with one another and wearing masks and decreasing activities outside the home. As you said, our ICU occupancy is already good and our positivity rate is meeting the criteria. So really, you know, if we want to move forward, we need to bring our case numbers down and bring our hospitalizations down. And we do that by wearing masks whenever around others outside the house and wearing good quality, double layered, snug fitting masks and making sure we decrease the number of interactions we have with others. I mean, it's uncomfortable. I am really tired of not doing anything with my family and with my friends. I'm exhausted. I know all of you are too. But if we want to get this virus under control, if we want to move forward, particularly with a smarter and faster virus coming now, we need to take very seriously all the preventive measures that we know work, put them together in a layered approach. And as we get more and more people vaccinated, that will add to our defenses and make us even more successful. But unfortunately, we've always known that this vaccination thing is going to take many, many months. We knew from the get-go that we were talking about, you know, a time frame of 6-8 months, you know, before everyone who is eligible would be able to get vaccinated. And that's what that means is we need to use all of our other tools until that time. We can't abandon them.
Thank you. Will James, you can ask your question.
Hi, thank you, Dr. Duchen. I'm wondering, is King County tracking adverse reactions to vaccine? And if so, have any of those been reported?
So thanks for your question. The vaccinators are required as part of their agreement with the state and the CDC. They are required to report adverse events through the National Vaccine Adverse Event Reporting System. That's how the vaccine adverse events are tracked nationally. Excuse me. Local health departments are not independently and simultaneously doing additional tracking. We do hear about adverse events intermittently, and we ask people to report. We ask them, and then at times we'll follow up if we have resources available to make sure that they report them appropriately and don't have any problems doing that reporting. But anything and everything that may or may not be attributed to a vaccine, should be reported, even if you're not certain. And the CDC and the FDA monitor these reports and then investigate whether or not there is a potential link to vaccination or not. As you know, things happen to people every day, regardless of whether or not they're vaccinated. So just being temporally associated doesn't necessarily mean that there's a link between a vaccination and an adverse event. But for things like allergic reactions, for example, we clearly need to look at those very carefully nationally. They've been reported rarely. I think the last figure I saw was about 11 per million, in the ballpark range of what we see with other vaccines. But with a new vaccine, we need to monitor safety and adverse events very closely. But that is not primarily our responsibility. And we provide information and facilitate that reporting so that our federal partners can investigate.
Thank you.
Dr. Duchen, let me get back to a few questions from the public. Do you have any sense of the amount of people who are refusing the vaccine or maybe hesitant to the vaccine from who are eligible in 1A? And do we have any record keeping around that?
No, we don't have data, although we are reaching out to our healthcare facilities to see if they've been tracking those who have been offered vaccine and decided not to be vaccinated. We only have anecdotal information and information that we've read about from other areas of the country that suggest certain people may be hesitant. But I shared with you our uptake levels. About 65% of doctors, 65% of registered nurses so far, 70% of physicians assistants, but only 30% of medical assistants and other technologists. So I'm assuming that there's some hesitancy that's contributing to those relatively lower numbers. Although I think there's also probably a significant amount of access issues there as well, because many of them may not be working in the healthcare facilities, and that's why we've been asking our healthcare facilities and other community vaccinators to make sure they're making vaccine available to healthcare providers throughout the community, not just those that work for their particular hospital or their particular clinic.
Thank you. And another question here from our Facebook folks listening in. Can you speak to why there's such a huge variance in positivity rates between wealthier and poor neighborhoods in King County? And what is King County doing about this disparity? And I know you've talked about this throughout the whole pandemic about some of the systemic issues, but maybe just to talk a little bit more about what you're seeing now.
Yeah, so that the increasing, or not the increasing, the high and the increased levels of positivity go hand in hand with the increased levels of cases, higher case rates, higher hospitalization rates, and in some communities, higher death rates. In communities of color, and particularly the communities in South King County, compared to other communities that are less diverse, more white, and more in the northern part of the county. And so positivity, is just another way of looking at the underlying increase in transmission and the fact that there are more cases occurring relative to the amount of testing that's being done. So, we have testing capacity in those communities. We're trying through ongoing outreach, multiple faith-based, small business, and community-based engagement and education activities to make people aware of the importance of being tested when they have symptoms, and isolating immediately when symptoms develop, and for those who've been exposed, quarantining. But what the high positivity rates tell us is that people are relative to the number of people who are infected, there's less testing happening. So people are either waiting longer or not coming forward with symptoms, or reluctant to be tested, or don't have, for some reason can't access our testing sites. But we've tried to increase both the location and the capacity of those sites in South King County. The current sites do have current capacity to test more people, and we would very much encourage people with any question about whether they've been exposed, they think they've been exposed, or they have symptoms that might be compatible with COVID to be tested. As more people come forward to be tested, the positivity rates will go down, we'll identify more cases. And the theory is that when you identify a case, when someone is diagnosed, then they go into isolation, and that prevents ongoing transmission, and their close contacts quarantine themselves, and that prevents ongoing transmission. So, making a diagnosis in and of itself doesn't guarantee that transmission will be interrupted. It's critical that people understand that from the time their symptoms develop, they need to be in isolation to prevent spread to others. And if indeed they are diagnosed with COVID, they need to inform their close contacts as quickly as possible so that those people can quarantine and prevent themselves from spreading COVID-19 to others, and be tested if they get symptoms, or if they've been documented to be in contact with the case, they should be tested either way, because we know that up to half of COVID-19 transmission comes from people before their symptoms develop or who have no recognizable symptoms, who look and feel well. So you can't tell who has COVID-19 by looking at them. Your friends, your family members, your coworkers may look and feel well, but yet be infected and unintentionally spread that infection to you and to others in their environment. So we have to be, extremely vigilant. And this gets back to my plea that we all adopt COVID-19 prevention measures to the greatest extent possible at all times, because we can't tell who's infected in our environment. We don't know that someone who we love, who looks well, who's our friend, is or is not, inadvertently, unintentionally exhaling COVID-19 virus particles into the air that we may inhale. So we need to always take precautions, all precautions at this point in the epidemic until we get this thing under control, assuming that everyone may be infected and taking those precautions. And the more precautions we take, the fewer cases there will be. But getting back to your point, we need to have more people come forward for testing to drive those positivity rates down.
And just one follow-up, given the rate of COVID that we have in the community, is there any recommendations that you have, particularly within households and in households where you may have people who are high risk, or households with people working in essential jobs who are coming back in? Anything more that people need to do within the household, particularly given you have transmission that can happen prior to symptoms? Anything new that we need to be doing in specifically?
Well, to prevent transmission in households, there are a few things to be aware of. One is, of course, to minimize the activities of household members that are not necessary to the greatest extent possible. So that cuts the risk of people becoming infected. If people must go out, for instance, essential workers, or obviously we all need to do essentials like grocery shopping. If people must go out, then to take those precautions around mask wearing, keeping distance, making interactions brief as possible, not limiting the time in contact with others, especially in indoor air spaces, making contacts brief, and then in the household again. To the extent you can, improve the ventilation. Even cracking a window, opening a door, getting airflow to recirculate will dilute any viruses that may be in the environment. So that's really important. Again, if there are people in the household who have symptoms, having them isolate from others to the extent possible, and even wearing masks in the household if there's a symptomatic household member or someone who is known to have COVID. Wearing masks will help protect the other household members. So those are all, and to the extent that the ill person can have their own bathroom, that would be another measure that could prevent transmission and reduce the risk to others. There's good guidance for this on our website and on the CDC website, how to prevent the spread of transmission if you're infected in your household. I refer everyone to look at the excellent guidance that's been updated recently on the CDC website about ventilation and improving ventilation and other steps that can be taken by workplaces and individuals to decrease their risk. But looking at all these different, ways that COVID can be spread and the many different strategies that we have to decrease that risk, and using as many of those strategies as consistently as possible and adding as many of them together as possible will decrease the risk as much as we can do.
Thank you. And I will get in one last question before we need to wrap up. Because you mentioned the variant strains that are potentially could be circulating or identified. There was a good question here about what we at Public Health are doing. Are we tracking that? Do we testing to pick up whether there would be a variance? And if you can talk a little bit about that system, I think that will be helpful.
Sure. So there are laboratories in the community who use a PCR test, which is the main test that's used to diagnose COVID-19, that can detect viruses that may be the new variant. Now, not every PCR test can detect this, but many can, and many of our laboratories are using this test. So a sample or a proportion of all COVID-19 tests are now being tested using a PCR method that can detect possible variant strains. When those possible variant strains are detected, then they're either forwarded to the Washington State Public Health Laboratory or another reference laboratory. Many go to our excellent virologists at the University of Washington, and they can further study those strains to see if indeed they are worrisome variants or just other strains that happen to have this genetic characteristic that flags them on the certain test. So there is a large number of labs that can detect these potential variants. When a potential variant is detected, it's forwarded to another laboratory where it's sequenced, so the actual mutations are described and studied. And when strains are detected that are potential variants that have significance from the public health perspective, then we are alerted and we can investigate further and try and understand whether there's spread happening or whether this is an isolated event. So, it's important to understand, all viruses mutate over time. So there are variants being created, constantly. Not all of these variants are significant. They don't change the way the virus behaves. They don't change the way they affect us. Sometimes they do, though, and those are what we call variants of significance or variants of concern. And those are the ones that are spreading, currently internationally, and that we anticipate will become very common here in the US over the next few months, particularly the B.1.1.7 variant that was first described in the United Kingdom. But the University of Washington, in addition to what I just described, is also testing a large number of samples that they obtain through their own COVID-19 testing programs. And they are both a local and a national and an international resource with the expertise of Trevor Bedford's lab and others who can sequence and rapidly communicate genetic information and lineage information to both local, national, and international stakeholders. So we are looking nationally. We don't have a robust program for molecular surveillance, although this is one of the things that I was very heartened to see in the Biden administration's COVID-19 plan is some funding to get this type of surveillance actually set up in a more systematic and robust way across the country. So that will be very welcome because it's an important part of our pandemic preparedness as well as our COVID-19 response. But at the moment, the bottom line answer to your question is yes, surveillance is happening. It's not every isolate, but over time, increasing numbers of isolates will be tested.
Thank you for that really insightful information for all of us. I appreciate it. Any last words, Dr. Duchen, before we wrap?
Well, again, thank you to everyone who is enduring this incredible challenge with us and doing what you can to protect yourselves and your families and our community. We've got still a long haul ahead of us. We've come a long way. It's been a very difficult year, and we still have many challenges before we are in a place where we can get back to the types of things we wanted to do and used to do before COVID without taking the types of precautions that are still incredibly important and necessary. So please understand that, if we're at halftime now, the virus is coming out with renewed energy, with more tricks, and is going to make our lives incredibly difficult for the next few months. And we need to double down on our COVID-19 prevention steps in every aspect of our lives, in our workplaces. And as we do, get that vaccine out to as many people as possible, as quickly as possible, because ultimately we will defeat this virus. We will reach population immunity. We will have the majority of our population vaccinated, but we need to make sure that before we get to that point, we do everything possible to decrease the number of us that get sick, that are hospitalized, and that die. And that challenge is still front and center. So I hope everyone is able to rejuvenate themselves a little bit and dedicate some renewed energy to keeping both you, your families, loved ones, and your community safe. Thank you, and I look forward to talking with you again in a week or so.
Thank you so much. And we'll add on Facebook also some links to some mental health and other kinds of supports, as we know we're going into this for the long haul. And so we've just put in some other resources about accessing support. There is a lot of support in our community. I think that's one real strength of being where we are in this. So we know we've got a long haul, as Dr. Duchen just said. We also hope that everybody can access the supports we need. So with that, thank you for joining us today, and have a safe weekend.